CMS, we were the first group to be awarded direct reimbursement from CMS and then from private insurance, which is significant and helps the pay of nurse anesthetists. CMS, you'll hear about physician supervision. The Centers for Medicaid that pay for Medicaid and Medicare require physician supervision of nurse anesthetists. That was supposed to be overthrown under Clinton, and Bush stopped it when he came in, and they came up with an alternative that allows states to opt out. But this physician supervision has nothing to do with supervision by someone qualified in anesthesia or an anesthesiologist. This supervision goes back to the old captain of the ship doctrine, where the surgeon is responsible for everything, which doesn't hold up today, and a lot of legal briefs show that that's no longer relevant. So, but yet for reimbursement, in some states, we're still required to have something in the policies that says that we're supervised, and this is usually by the order of having surgery, therefore orders anesthesia, which gives you the authority under the surgeon to practice anesthesia, but it's not them directing your care. And that's a complicated subject. These are the states that have already opted out, so that there is no physician supervision. Remember, this is only an issue of reimbursement. This is not necessarily a practice issue. But this is a very confusing subject. And the physicians always would go on and on about this, and the surgeons, and so who's supervising and who's directing? It's not clear, and that's not what it makes you feel like. So they also say, well, we're going to be more liable, and I usually go into more detail and prevent legal briefs that show that they're not liable anymore for nurse anesthesia practice than they are for physician anesthesia practice. What makes them liable is when they start trying to throw their weight around and tell you what to do, and things go bad, and then later everybody says, well, the surgeon insisted that they not give the blood, or something like that. Here's a modern OR with a cell saver and a bunch of other monitors. So it's a broad-based thing. We're more involved with the perioperative period. There's three broad categories of anesthesia: general anesthesia, monitored anesthesia care, which is sedation or IV conscious sedation type. But when an anesthesia-trained person does it, it's called monitored anesthesia care. Regional anesthesia is a broad area that can cover anything from neuraxial, spinal, epidural anesthesia to nerve blocks. And then a lot of things that go along with monitoring and managing emergency care, ICU care, or in both acute and chronic pain management are all areas that are strongly inside anesthesia. This is just the brachial plexus and some nerve blocks, and I'm going to skip through this part. It's not just in the operating room. We work, as I said, in different areas through the hospital. This is a modern, this is called mystery anesthesia or something. It's a modern oil painting. Some non-medical person's fantasy on acid, I think, of anesthesia or something. I don't know. I just threw it in there. More blocks. International Federation of Nurse Anesthetists I mentioned. The last conference, I think, was in Vienna. So that would be fun to go to. I'm going to answer any questions you have about anesthesia, and I'm just going to mention briefly, because I think the next thing that I'm going to talk about relates to us as nurses, because there's a lot of different areas we can work in as nurses, as nurse anesthetists, nationally and internationally. And my assignment now is with called the Afghan Health Initiative. Office of Global Health Affairs manages this program, and they've taken people, epidemiologists from the Centers for Disease Control, and clinical people, because that's where we have clinical people in the Indian Health Service, and I'm a commissioned officer in the Public Health Service. And there's just a huge proliferation of non-government agencies, government agencies, and contractors working in Iraq and in Afghanistan, among other countries, in all different areas, from agriculture, anti-terrorism, teaching them how to govern, and politics, as well as medicine. And I'm assigned to a hospital, a women's hospital, very busy one. We average over 50 deliveries every single day, day in and day out, with very high morbidity and mortality. So this is where they come up with this idea of the Afghan Health Initiative, was to address the worst mother-child morbidity mortality rates in the world outside of Darfur. And so, and I already mentioned about how poor, how much they're lacking in technology there. Well, that's a different slide. That's a different intervention. That's Katrina. Afghan Health Initiative is what I meant to put up there. But we're still helping people. So you don't need to look at this too much. This is our organogram, and the people in the CDC love this stuff and statistics, and I have to get involved with a little bit of it to appease them. But I really am more clinical, and so this is the anesthesia people. I'm working with another anesthesia people down here, so I'm here under the IHS group. This is Rabia Balki Hospital. This is not really the structure, but you have to go through this tunnel, and this is on the streets of Kabul. And I just got back a few days ago. From there, I'll be involved with this all year and going back a couple more times. That's a white prayer cap he's wearing, and I'm not standing right in front of these ladies photographing them trying to hide. I'm actually zooming in from way across the plaza, and they were just, they're covered up a lot in their burqas, various types of burqas. This hospital is not maybe the safest place to work because the Taliban has a lot of, gaining a lot of power there still, and they don't really take kindly to men working in women's hospitals. But still, the Afghan, most of the anesthesia is given by male nurse anesthetists here, strangely enough, and women. It's almost 50-50, but there's more men. I find that kind of interesting. I didn't know that. And some anesthesiologists, and I'm working with all of them, training them about departmental organization, QA things, a lot of administrative stuff, as well as clinical issues. This is some of my staff, the nurse anesthetists. The guy on the far right is a physician, and he's my full-time interpreter there. So he loves it because he's making a lot more interpreting than he does as a physician. Just a few years ago, this large building was all heated by wood, and there's a pile of wood out in front, and all day long these ladies had to haul the wood in and out. The military came in and put some radiators in, and so there's no longer smoky patient care rooms. But they were full of smoke all the time. The draft wasn't right. So this is just a hospital room, and one of my guys pretending to work because they're taking our picture. This is one of my anesthetists doing general anesthesia. She has a machine. The ventilator actually works in this machine, but there's no inhalation agent. So she just keeps titrating a little bit more, either pentothal or ketamine and narcotics in, and sometimes diazepam. Therefore, a lot of the patients have recall. And sometimes they're not very sensitive to patient pain. They don't talk to them. And so that was one of the things I was trying to model, was trying to be a little more kind in surgery. This is an OBGYN physician from Indian Health Service in Oklahoma that I'm working with. I met some guys that work for the anti-terrorist assistant group that trained bodyguards for President Karzai. Got to talk to him. He's a medical advisor. He said, we'd love to have you come over and cross-train the bodyguards, because if they shoot the president, it'd be great if they would know how to stop the bleeding and do a few first aid things. And they would also, but they wanted to learn nerve blocks, the physicians in the clinic. So I got invited to the presidential palace, which was just down the street, and this is where President Karzai is, and also the brother of the last king lives with his family. And it's like 3 fortresses, a fortress inside a fortress inside a fortress. Yeah, it's very highly secure. You're not supposed to take any pictures in there. So, and this is one of the older ones, but I was always sneaking them off when I could. If the driver would have let me, it was up to him. But there's a lot of people with gun posts everywhere looking around, so when they're looking at you, you don't pull your camera out. They will take it away from you. This is about 350 years old. It was part of the old original palace, and Karzai lives right near here. And I don't know the story about this tower, but I know it's a few hundred years old. There's a wall, there's a kind of like a wall they built to keep out the Mongols, just like the Great Wall of China, to keep the Mongols out also. It didn't work here either. They, again, just went around it and took over.